I couldn't find my son. I went out late looking for him, and an ambulance was there. They found him. A security guard found him at the apartments next door, called 911. He was hardly breathing.
As a community, we are not doing enough to save our own from this deadly plague. Can you all sleep tonight by not passing this moratorium and know that in 35 hours, another one's going to be dead?
The statistics are alarming. Every 32 hours in Pinellas County, someone dies of a drug overdose. That equates to 5 people a week or 23 people each month. In a year's time, in 2010, 280 people died of accidental drug overdoses. 249 of those deaths were due to abuse of prescription pain medication. OxyContin, Vicodin, Xanax, and other perfectly legal drugs prescribed by area doctors take more lives than all the homicides, suicides, and automobile-related fatalities that happen in Pinellas County. Abuse of prescription drug medication and abuse of synthetic drugs has become rampant in Florida and Pinellas County. And county officials are fighting back with local ordinances and public education to stop an alarming trend that is destroying lives and devastating families across all demographic lines in our communities. Hello everyone, I'm Len Szynski with the Pinellas County Communications Department, and welcome to Part 1 of Fighting Back Against Prescription Drug Abuse. The statistics we mentioned can sometimes turn into a blur of meaningless numbers. So we begin our program by sharing the story of one young man and one heartbroken family caught up in a tragedy that has repeated itself far too often in our community.
I've never met anybody that would come to you smiling every time, no matter what, because he was happy to see you, and it was such a genuine smile.
The parents of Matthew Serra remember him as a boy that never stopped smiling. Mark and Lori recall the many times people stopped them to ask if their son was an actor. People were drawn to him. Matthew was smart, energetic, athletic, a risk-taker. He was also addicted to prescription pain medication, which took his life at the age of 28. For Mark and Lori Serra, finding out about their son's death was a parent's worst nightmare.
Friday evening for us, our doorbell wasn't working. We heard this loud knock at the door, and it's pretty odd around 9:30, 10 to have somebody knocking on your door. Mark went and looked out through the glass in our front doors, and he said, "The police are here. Why are the police here?" And I got to tell you, I knew immediately. They looked at my husband and said, "You know, are you the father of Matthew Serra?" And Mark couldn't speak. He just nodded. And at that point, just sat in the chair. And then they informed us that Matthew had been found that evening in Largo in his apartment.
Matthew was killed by a combination of methadone, OxyContin, and Xanax. It all started in college when Matthew injured his back. A swimmer, he was under the care of the team doctor. But after he graduated and started at the University of Florida, Matthew turned to doctors in Gainesville to manage his pain. They freely dispensed prescriptions, and before long, Matthew was addicted.
As Matthew became more and more addicted, he learned where to go, not only here locally and within the Pinellas community, but within Tampa Bay, and even going over to the East Coast at times, or having somebody bring him, pills from over there.
The Serras were devastated. The boy they knew was a star swimmer in Seminole High School, captain of the swim team, and president of the Pre-Law Society at Virginia Military Institute. With his blended family of 6 siblings, he went skiing, diving, and mountain climbing. Now he was fighting for his life.
Matthew had been in treatment several different times. One faith-based treatment program that he was in, he was there for about 6 months, and it was the best he'd been in a long time.
We had such hope at that point. We said, our Matt's back, our Matthews come back. This was great.
And he had hope. You know, he began to have goals again, other than just where he could get his next pill. He began to have a life again and a future.
Then he made the mistake of taking a lethal combination of 3 pills, bringing his 6-year struggle to a tragic end.
Our family will never be the same. And even though it's been over 3 years, we'll be driving down the road, and for one brief moment, we forget Matthew's gone.
Within 6 months of Matthew's death, Mark and Lori were in Tallahassee lobbying for a statewide drug monitoring program. And back home, they started the Pinellas County chapter of NOPE.
We tried to tell other people. We try to tell kids that it's not just them that they're working with. It's all the people in hurting. It's all the people that love them.
Because they are willing to share the pain of losing a son and talk to kids and their parents about prescription drug abuse, the Serras know they have saved lives. They find solace in that, and in their memories of a handsome child with a smile that wouldn't quit.
That's probably the number one thing I'll remember, him smiling.
Well, thank you to the Communications Department's Mary Burrell for that very poignant profile. Well, right now, allow me to introduce all my guests for our Fighting Pack program. First up is my co-host for this series. He is Paul Melton, investigator for the Pinellas County Department of Justice and Consumer Services. And also joining us for this segment of our program is Pinellas County Sheriff Bob Gualtieri, along with Tim Burns, the director of the Department of Justice and Consumer Services. And gentlemen, it's a pleasure to have you here. Paul, it's a pleasure to have you on board as well.
Thank you.
Now, Paul, we've seen this poignant story. We've heard the statistics. Prescription drugs are supposed to help people, supposed to make them well, supposed to make them feel better. What has happened here in Pinellas County?
Well, prescription drugs are designed to do that, but when you misuse the drug, when you divert them for their intended purpose, it becomes a problem. And Sheriff Gualtieri, his department, has been out on the forefront ever since this problem started here in Pinellas. He's been out there dealing with the problem. So, Sheriff, we'd like to turn it over to you and ask you, what have you seen? How has this problem evolved, and what actions is the department taking?
Well, we saw it 4 or 5 years ago, and we saw it because it just permeated our calls for service on a daily basis. And we saw it affecting all demographics, all areas of the county. And there's 2 ingredients, I believe, that are the perfect storm to this problem. One is the ease of access. Unlike cocaine, heroin, some of these other drugs, you don't have to go find a drug dealer on a street corner. For big quantities, you don't have to go to South Florida or the southwest border in Texas. You go to a pharmacy, you go to a CVS or a Walgreens. So it's the ease of access, and then the unintended addicts. Generally speaking, with cocaine or crack cocaine, is that you didn't see people who are addicted who are 75 or 80 years old. You do see that with the pharmaceuticals. So the ease of access and the unintended addicts are a big problem, and we see it through thefts and domestics and disturbances and you name it on a daily basis. So we had to put a lot of resources at it, and we did. And of course, then the prolific upswing of all the pain management clinics, and we know what those are. Those were a lot of those, not all of them, but a lot of them were just, as we call them, pill mills, which are just healthcare practitioners, so to speak, really just drug dealers wearing white coats. Right. So we put a lot of resources at that, and through a collective effort of everybody, county government and cities and task forces, and we've made a dent in it. But this is a problem that we as law enforcement are not going to solve. And we're not going to solve it because it's an addiction problem. And because it's an addiction problem, to get to the root of it is that I think there needs to be a significant focus on prevention, education, and treatment. And law enforcement will continue to deal with the consequences of the problem. We will continue to deal with the consequences effectively, but locking people up isn't a solution.
Well, I think that one of the complications in all of this is that we're trying to ask law enforcement to enforce a situation that dealing with perfectly legal substances, right, and people that keep skirting the definition of what's legal and what's not. How do you get around that complication?
Well, and that does make it tough because there is, of course, a legitimate use for these drugs, and pain management is important, and there are legitimate pain management practitioners, and trying to figure out the difference and deal with those people that are trying to capitalize on that industry and that practice of medicine and using it for illicit purposes. So it is a problem.
Is the state helping to control the situation?
Oh, they're helping. A lot of people are helping. And an example of that is where the state came in and they did pass the Prescription Drug Monitoring Database, or the PDMP as it's called. And I applaud the governor and the legislature and the attorney general for getting that passed. It's a step in the right direction, but it's not a solution. And there's a couple of reasons for that. One is it's a voluntary program. People think it's mandatory. It's not. It's voluntary. And the dispensing practitioners have up to 7 days to enter the data in the system, so it creates this window. And that doesn't go to the pill mills. That goes to what's called doctor shopping. So there's so many facets to the problem, and people really need to understand it's multifaceted.
Now, Paul, I understand that we're not waiting for the state at the local level to take a definitive action. We've kind of got the, taken the bull by the horns in our own way.
And we have, we've instituted locally a pain management ordinance, which is now called a high prescriber ordinance, and we're trying to regulate some of these doctors a little bit at the local level. And so I'd like to ask Tim Burns, the director of my department, about a little bit about the origin of the ordinance and what county government, which is tasked with maintaining, looking after the population of Pinellas County, the health, the welfare of those folks. What has county government done to work with the sheriff's office and other coalition partners on this problem?
Thank you. The main thing that we've noticed with the prescription drug issue, we started seeing statistics that were going through the roof. Everything from the number of deaths to drug-addicted newborns to youth being removed from their families because of parents that are addicted. Whenever the commissioners saw that this was occurring, they decided that the county had to take action in terms of putting an ordinance in place to understand who was operating in Pinellas County initially as a pain clinic. And we felt that was a critical component to being able to get the information about who was operating, how were medicines being dispensed into the community, and trying to deal with this and working in a collaborative way with the sheriff's office and eventually with the state whenever they started doing additional actions, I think has been critical. But the board felt that there had to be a regulatory process put in place. So in May 2010, they put an ordinance in place. It began to register individuals that were registered as, or were called pain clinics. We also found, though, over time that was kind of a little bit of a loophole, because what you call yourself isn't actually how you practice. There's been a wide range of physicians that have been investigated, that have been arrested, and some convicted now, that were not pain doctors. They were regular general practitioners. One was a pediatrician. So we changed our ordinance last year to become a high prescriber ordinance. So it was more about how you're practicing and less about what you call yourself. And we felt that was a critical component.
So once again, people are trying to stay one step ahead of the ordinances. They're very resourceful. There's a lot of money to be made, and that causes people to be tremendously creative sometimes.
Yeah, individuals start calling themselves interventional and physiatry and everything but pain clinic in order to avoid registration with the state or locally. And that was definitely a concern. Right now we're seeing some very good progress in Pinellas County. The sheriff's efforts in terms of going in and enforcing and addressing locations that are acting more like a pill mill than anything else has been critical. Department of Health stepping in and starting to do more reviews of locations has been critical. Being able to understand who is operating in Pinellas County as a physician or in a questionable type practice, I think is a very important thing. But my concern is making sure that we also don't mistake progress with having solved the problem. We have seen a reduction in the number of drug-addicted newborns so far trending this year, although we went up from 2005 to 2010 by almost 600%. Right. There's big problems that still need to be solved, and I think the treatment and the addiction is one of the critical components.
Well, I know we've done a lot, Paul, but it seems like there's so much more work to do. What is in store for the future? And Bob and Tim, if you could talk to us about what some of the programs coming up.
Well, we're going to just continue our enforcement efforts, and we need to continue to do that. And we have one of the ways that we measure the success of enforcement efforts is the street level price of drugs. And for several years, we didn't see any change. You could buy a generic Oxycontin for about $1 a pill at a pharmacy, and it was selling on the streets. The price was roughly somewhere around $17 a pill. Finally, now we're starting to see that price go up, which is a good thing because it tells us that the supply is going down a little bit. So we need to continue with the enforcement efforts and continue to try and drive that supply down. But you're not going to change the demand until you deal with the addiction problem. And this is where all the community partners come into play that are practicing in that treatment in realm. And there needs to be a lot of support for them, I believe, because it is an addiction problem. And prevention is paramount, because once you get into treatment, of course, you already got a problem. So this is where the organizations that are in the schools, that are in the community, are really at the forefront of trying to seriously and effectively deal with the problem.
So many facets of this problem, and of course we'll be talking about some of these other facets on our program series coming up, but there's a lot to talk about, and it's a big problem, and I think it's great that we're doing what we can now to try to get our arms around it on a local level. Well, I'd like to thank my guests for this part of the program. My co-host, Paul Melton, investigator with the Pinellas County Department of Justice and Consumer Services, along with Tim Burns, the director of that same department, and Pinellas County Sheriff Bob Gualtieri. Well, coming up on part 2 of Fighting Back, we meet grief-stricken parents who relive the tragedy of losing a loved one nearly every single day, all for a good cause. Make sure you're with us.